10 warning signs of prostate cancer that you should not ignore. What if there's a silent threat that could be lurking in your body right now? A danger so subtle, you might not even notice it until it's too late. We're talking about prostate cancer, a condition that affects millions of men worldwide. But here's the catch: if caught early, it's highly treatable. So why do so many men miss the warning signs? In this eye-opening exploration, we'll uncover the 10 warning signs of prostate cancer that every man needs to know. But before we dive in, let's set the stage with some startling facts that might just save your life or the life of someone you love. Imagine this: you're sitting in a room with 8 other men. Look around. Statistically, one of you will likely face prostate cancer in your lifetime. That's right. Prostate cancer is the second most common cancer in men, trailing only behind skin cancer. It's a sobering thought, isn't it? But here's where it gets interesting. Despite its prevalence, many men know surprisingly little about their prostate or the warning signs of prostate cancer. It's time to change that, and we're here to guide you through it all. Before we delve into the warning signs, let's take a moment to understand what we're dealing with. The prostate, a small gland about the size of a walnut, plays a crucial role in male reproductive health. Located just below the bladder and surrounding the urethra, this tiny powerhouse produces seminal fluid, which helps sperm travel and survive. But when cancer strikes this vital gland, it can wreak havoc on a man's body in ways you might not expect. That's why recognizing the early signs of prostate cancer is crucial. And trust us, some of these signs will surprise you. Here's a chilling statistic: in 2022, an estimated 200,000 men in the United States alone were diagnosed with prostate cancer. Even more concerning? Over 40,000 men lost their lives to this disease. But here's the silver lining: when caught early, prostate cancer has a significantly lower risk of becoming fatal. So, why do so many cases go undetected until it's too late? The answer lies in the subtle nature of prostate cancer symptoms and, frankly, in many men's reluctance to discuss or address their health concerns. But knowledge is power, and that's exactly what we're here to give you. Are you ready to uncover the hidden signs your body might be sending you? Buckle up, because we're about to take a deep dive into the 10 warning signs of prostate cancer that every man needs to know. Some of these might seem obvious, but others, well, let's just say they might catch you off guard. 10. Feeling painful or burning when urinating. Imagine this: you're going about your day when suddenly, a trip to the bathroom becomes an ordeal. The simple act of urination, something you've done countless times without a second thought, now causes a burning sensation or pain. It's uncomfortable, it's worrying, and guess what? It could be one of the early signs of prostate cancer. But why does this happen? As prostate cancer develops, it can cause the gland to enlarge, disrupting the normal flow of urine. This obstruction can lead to painful urination, also known as dysuria. But it doesn't stop there. In some cases, the cancer might spread to nearby structures, including the urethra, bladder, or rectum, further exacerbating the problem. Now, before you panic, it's important to note that painful urination can have other causes, such as urinary tract infections or benign prostate enlargement. However, if you're experiencing this symptom persistently, it's crucial to get it checked out. Remember, when it comes to prostate cancer symptoms, it's always better to be safe than sorry. Interestingly, the pain or burning sensation might not always be due to the cancer itself. Sometimes, it can be a side effect of prostate cancer treatment. Radiation therapy, for instance, can cause inflammation in the urinary tract, leading to discomfort during urination. But here's where it gets tricky. The enlarged prostate doesn't just cause pain, it can also lead to urinary retention. This means your bladder doesn't empty completely when you urinate, which can lead to bacterial growth and infection. And you guessed it, this can cause that burning sensation too. So, what should you do if you're experiencing painful or burning urination? First, don't ignore it. Schedule an appointment with your doctor. They might recommend tests like a urinalysis or a prostate-specific antigen (PSA) test to get to the root of the problem. Remember, prostate cancer signs and symptoms can be subtle, and they often mimic other conditions. That's why it's crucial to work with your healthcare provider to determine the cause of your symptoms. 9. Urinating often, especially at night. Picture this: you're finally drifting off to sleep after a long day when suddenly, nature calls. Again. And again. And again. If you find yourself making multiple trips to the bathroom throughout the night, you might be experiencing nocturia, a condition that could be one of the warning signs of prostate cancer. Nocturia, or frequent nighttime urination, is more than just an annoyance. It's a potential red flag that shouldn't be ignored. But why does prostate cancer cause this unsettling symptom? As the prostate gland enlarges due to cancer, it can press against the urethra, the tube that carries urine from the bladder out of the body. This pressure can create a sensation of needing to urinate more frequently, even when your bladder isn't full. It's like having a constant false alarm going off in your body. But it's not just about nighttime trips to the bathroom. Frequent urination during the day is also one of the prostate cancer signs to watch out for. If you find yourself needing to urinate more often than usual, or if you have trouble emptying your bladder completely, it's time to pay attention. Now, let's be clear, frequent urination doesn't automatically mean you have prostate cancer. It could be due to other factors like an overactive bladder, urinary tract infection, or even just drinking too much fluid before bed. However, when combined with other symptoms, it could be pointing to something more serious. Here's an interesting fact: doctors often use what's called a bladder diary to assess the severity of urinary symptoms. This involves keeping track of how often you urinate, how much you urinate each time, and what fluids you drink throughout the day. It might sound tedious, but this simple tool can provide valuable insights into your urinary health. But why is nocturia such a big deal? Well, besides being incredibly frustrating, it can seriously impact your quality of life. Constant sleep interruptions can lead to daytime fatigue, decreased productivity, and even mood changes. In severe cases, it can contribute to sleep deprivation, which carries its own set of health risks. So, what should you do if you're experiencing frequent urination or nocturia? First, don't panic. Instead, start by keeping track of your symptoms. How many times are you urinating during the day and night? Has there been a sudden increase? Are you experiencing any other unusual symptoms? Once you have this information, it's time to talk to your doctor. They might recommend further tests, such as a digital rectal exam or a PSA test, to check for prostate cancer. Remember, early detection is key in successfully treating prostate cancer, so don't hesitate to seek medical advice if you're concerned. 8. Visible blood in the urine. Imagine this scenario: you're going about your day when suddenly you notice something alarming. Your urine has a pinkish tint, or worse, it's distinctly red. This sight can be shocking and frightening, and for good reason. Blood in the urine, known medically as hematuria, is one of the more serious prostate cancer symptoms that demands immediate attention. Now, let's be clear: seeing blood in your urine doesn't automatically mean you have prostate cancer. It could be due to a variety of other conditions, some of which are less serious. However, when it comes to potential signs of prostate cancer, this is one symptom you absolutely cannot ignore. But why does prostate cancer cause blood in the urine? As prostate cancer advances, it can invade nearby tissues and organs, including parts of the urinary system like the bladder or urethra. This invasion can cause bleeding, which then mixes with urine, resulting in hematuria. Interestingly, there are two types of hematuria associated with prostate cancer. 1. Microscopic hematuria. In this case, the amount of blood is so small that it's only detectable under a microscope. You won't be able to see it with the naked eye, which is why regular checkups and urine tests are so important. 2. Macroscopic hematuria. This is when there's enough blood in the urine to change its color visibly. It might appear pink, red, or cola-colored. Here's a startling fact. Studies show that about 3 to 5% of men with prostate cancer may experience visible blood in their urine. While this percentage might seem small, it represents a significant number of men given how common prostate cancer is. But here's where it gets tricky. Hematuria is typically associated with more advanced stages of prostate cancer. This means that by the time you see blood in your urine, the cancer may have already spread beyond the prostate gland. This underscores the importance of recognizing other, earlier warning signs of prostate cancer and getting regular checkups. If you do notice blood in your urine, what should you do? The answer is simple: seek medical attention immediately. Your doctor will probably do several tests to find out why this is happening. These might include urinalysis to confirm the presence of blood and check for signs of infection, urine cytology to look for cancer cells in your urine, imaging tests such as CT scans or ultrasounds to visualize your urinary tract, cystoscopy, a procedure where a thin tube with a camera is inserted into your urethra to examine your bladder and urethra. Remember, while blood in the urine can be a sign of prostate cancer, it's not the only possible cause. Kidney stones, urinary tract infections, and other conditions can also lead to hematuria. However, given the potential seriousness of prostate cancer, it's crucial to get any instances of blood in the urine checked out promptly. 7. Pain in your back, hips, or legs. Picture this: you wake up with an annoying pain in your lower back. At first, you might brush it off as the result of yesterday's workout or an awkward sleeping position. But what if that pain persists or even spreads to your hips and legs? While it might not be the first thing that comes to mind, this could actually be one of the lesser-known warning signs of prostate cancer. You might ask, how can prostate cancer make my back or legs hurt? It's a fair question, and the answer lies in how prostate cancer can spread if left unchecked. In advanced stages, prostate cancer has the ability to metastasize or spread to other parts of the body. One of the most common sites for prostate cancer to spread is to the bones, particularly those in the back, hips, and legs. When cancer cells invade these bones, they can cause pain, weakness, and even fractures. Here's a startling fact that underscores the importance of recognizing this symptom. A study found that men experiencing back pain had a 50% higher chance of being diagnosed with prostate cancer compared to those without back pain. This clear correlation between back pain and prostate cancer diagnosis is something every man should be aware of. But it's not just about back pain. Men with advanced prostate cancer often report a range of discomforts: dull, persistent pain in the lower back, hips, or upper thighs, weakness or numbness in the legs or feet. Sitting for a while makes you hurt. The pain gets worse at night or when you lie down. It's important to note that not all back or hip pain is a sign of prostate cancer. In fact, these types of pains are common and can be caused by numerous other factors, from muscle strains to arthritis. However, if you're experiencing persistent or unexplained pain in these areas, especially if you're in a higher risk group for prostate cancer, it's crucial to get it checked out. So, what should you do if you're experiencing these types of pain? First, don't panic. Instead, pay attention to your symptoms. How long have you been experiencing the pain? Is it getting worse over time? Does it come with any other symptoms, like changes in urination habits? Remember, early detection is key when it comes to prostate cancer. By being aware of all potential symptoms, including less obvious ones like back or hip pain, you're taking an important step in protecting your health. 6. When pounds disappear without effort. Imagine this scenario: you step on the scale one day and notice you've lost weight. At first, you might feel a sense of triumph. After all, who doesn't want to shed a few pounds? But what if you haven't been trying to lose weight? What if the pounds keep disappearing without any changes to your diet or exercise routine? This unexplained weight loss could be more than just a lucky break. It could be one of the warning signs of prostate cancer that many men overlook. Now, you might be thinking, how could cancer cause weight loss? That's a good question. The answer is about how cancer changes the way your body uses food and makes you feel hungry. Prostate cancer, like many other types of cancer, can cause a range of systemic effects on your body. One of these is a decrease in appetite, often accompanied by nausea and sometimes vomiting. These symptoms can lead to reduced food intake and subsequent weight loss. But it goes deeper than that. Cancer cells are voracious consumers of energy. They multiply rapidly and require a lot of nutrients to fuel their growth. This increased energy demand can lead to weight loss even if you're eating normally. It's as if your body is running a marathon without you even knowing it. Here's an interesting fact: some prostate cancer patients report a change in how certain foods taste. This alteration in taste perception, known as dysgeusia, can make previously enjoyable food seem unpalatable, further contributing to reduced food intake and weight loss. But let's put this into perspective. Unexplained weight loss is typically associated with advanced stages of prostate cancer. In the early stages, most men don't experience noticeable weight loss. This is why it's crucial to be aware of other, earlier warning signs of prostate cancer and to get regular checkups. So, how much weight loss should concern you? Generally, doctors become concerned when a person loses more than 5% of their body weight over 6 to 12 months without trying. For a 180-pound man, that would be about 9 pounds. If you notice unexplained weight loss, here's what you should do. 1. Start keeping a record of your weight. Note how much you've lost and over what period of time. 2. Pay attention to other symptoms. Are you experiencing changes in appetite? Fatigue? Changes in urination habits? Remember, unexplained weight loss doesn't automatically mean you have prostate cancer. It could be due to other health conditions, stress, or changes in diet or physical activity that you haven't noticed. However, given that it can be a sign of advanced prostate cancer, it's a symptom that should never be ignored. In the context of prostate cancer treatment, maintaining a healthy weight becomes even more crucial. Some treatments for prostate cancer can cause weight gain, while others might lead to further weight loss. This is why doctors often recommend a balanced, nutrient-rich diet for prostate cancer patients. By being aware of this potential symptom and seeking prompt medical attention if you experience unexplained weight loss, you're taking an important step in protecting your health. Remember, when it comes to prostate cancer signs and symptoms, knowledge truly is power. 5. Pain in the rectum. Let's talk about a topic that might make you squirm a little: rectal pain. It's not something most men want to discuss, but when it comes to potential prostate cancer symptoms, it's a conversation we need to have. Imagine this: you're going about your day when suddenly you feel a discomfort or pain in your rectal area. It might be a dull ache, a sharp pain, or just a general feeling of pressure. While there could be many causes for this discomfort, it's important to know that it could also be one of the signs of prostate cancer. But why would prostate cancer cause rectal pain? The answer lies in the prostate's location. The prostate gland sits just in front of the rectum, and as prostate cancer grows, it can spread to nearby tissues, including the rectal area. This invasion can cause a range of uncomfortable symptoms. Here's what you might experience. Your bottom feels stuffed or like something's pushing on it. Discomfort or pain when sitting. Difficulty having bowel movements. Your poop habits change, you might get constipated or have diarrhea. A sensation of incomplete bowel emptying. Rectal pain isn't always a sign of prostate cancer. It could be caused by hemorrhoids, anal fissures, or other digestive issues. However, when combined with other prostate cancer symptoms, it's a warning sign that shouldn't be ignored. Interestingly, rectal pain can also be a side effect of some prostate cancer treatments, particularly radiation therapy. This is because radiation can sometimes affect the healthy tissue surrounding the prostate, including the rectum. So, what should you do if you're experiencing rectal pain? First, don't panic. Instead, 1. Pay attention to when the pain occurs. Is it constant, or does it come and go? 2. Note any other symptoms you're experiencing, especially changes in urination habits. 4. Painful ejaculation. Now, let's delve into a topic that's often whispered about but rarely discussed openly: painful ejaculation. It's a sensitive subject, but when it comes to potential prostate cancer signs, it's one that needs to be addressed. Imagine this scenario: what should be a moment of pleasure suddenly becomes an experience of discomfort or even pain. This isn't just a mood killer, it could be your body sending you an important message. Painful ejaculation, medically known as dysorgasmia, is reported by about 2 to 3% of men with prostate cancer. While this percentage might seem small, it represents a significant number given how common prostate cancer is. But why does prostate cancer cause pain during ejaculation? The answer lies in how prostate cancer can affect the structures involved in the ejaculation process. As the cancer grows, it can irritate or put pressure on the nerves and tissues involved in ejaculation, leading to discomfort or pain. Here's what you need to know about painful ejaculation as a potential prostate cancer symptom. The pain can occur during or immediately after ejaculation. In some cases, the discomfort can last for several hours or even up to a day after ejaculation. The pain might be felt in the penis, testicles, or the area between the scrotum and rectum, perineum. Some men describe it as a burning sensation, while others experience a sharp pain. Painful ejaculation isn't always a sign of prostate cancer. It can also be caused by other conditions such as prostatitis, inflammation of the prostate, urinary tract infections, or even certain medications. However, when combined with other prostate cancer symptoms, it's a warning sign that shouldn't be ignored. Painful ejaculation can also be a side effect of some prostate cancer treatments, particularly radiation therapy and certain surgical procedures. This is because these treatments can sometimes affect the nerves and tissues involved in the ejaculation process. So, what should you do if you're experiencing pain during or after ejaculation? Here are some steps to take. 1. Don't ignore it or feel embarrassed. This is a medical issue that deserves attention. 2. Keep track of when the pain occurs and how long it lasts. 3. Note any other symptoms you're experiencing, especially changes in urination habits. 3. Pain while sitting. Let's talk about something that might seem mundane but could be a crucial warning sign: discomfort while sitting. It's easy to brush off as just another ache or pain, but in some cases, it could be one of the lesser-known signs of prostate cancer. Picture this: you're at your desk, engrossed in work, when you suddenly realize you've been shifting uncomfortably in your chair. Or maybe you find yourself dreading long car rides because sitting for extended periods has become painful. These scenarios might seem trivial, but they could be your body trying to tell you something important. Why would prostate cancer cause pain while sitting? The answer lies in the location of the prostate gland. Situated just below the bladder and in front of the rectum, an enlarged prostate due to cancer can put pressure on surrounding tissues and nerves. This pressure can cause discomfort, especially when sitting on hard surfaces. Here's what you need to know about sitting pain as a potential prostate cancer symptom. The pain is often described as a dull ache in the lower back, pelvis, or upper thighs. It may be more noticeable when sitting on hard surfaces or for extended periods. Some men report a feeling of pressure or fullness in the perineal area, the area between the scrotum and rectum, when sitting. The discomfort might be accompanied by numbness in the same areas. It's important to note that not all sitting discomfort is a sign of prostate cancer. It could be due to other factors like poor posture, herniated discs, or other musculoskeletal issues. However, when combined with other prostate cancer symptoms, it's a warning sign that shouldn't be ignored. A specific type of prostate cancer, called prostatic adenocarcinoma, is most commonly associated with pain while sitting. This type accounts for about 95% of all prostate cancers, making it crucial to pay attention to this symptom. So, what should you do if you're experiencing persistent discomfort while sitting? Here are some steps to take. 1. Pay attention to when and where the pain occurs. Is it worse on certain surfaces or after sitting for a specific length of time? 2. Note any other symptoms you're experiencing, especially changes in urination habits or sexual function. 3. Try changing your sitting position or using a cushion. If the pain persists despite these changes, it's time to see a doctor. 2. Problems with urination. Let's dive into a topic that many men find frustrating but are often hesitant to discuss: problems with urination. While it's easy to dismiss changes in urinary habits as a normal part of aging, they could actually be one of the key warning signs of prostate cancer. Imagine this scenario: you are standing at the toilet, ready to relieve yourself, but nothing happens. Or perhaps the flow starts and stops unpredictably, or it's just a weak trickle instead of the steady stream you're used to. These situations aren't just annoying, they could be your body's way of alerting you to a serious health issue. Why does prostate cancer cause urinary problems? The answer lies in the prostate's location. The prostate is wrapped around the P-tube that goes from your bladder to outside your body. As prostate cancer develops, it can cause the gland to enlarge, putting pressure on the urethra and disrupting the normal flow of urine. Here's what you need to know about urinary problems as a potential prostate cancer symptom. Difficulty starting urination, hesitancy. Weak or interrupted urine flow. Dribbling at the end of urination. Feeling like you can't completely empty your bladder. Increased frequency of urination, especially at night. Sudden urges to urinate. These urinary symptoms don't automatically mean you have prostate cancer. They can also be caused by benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate that's common in older men. However, because these symptoms can be signs of prostate cancer, they should never be ignored. Here's an interesting fact: studies have shown that up to 25% of men with prostate cancer report experiencing some form of urinary problem. This makes urinary symptoms one of the most common prostate cancer signs. So, what should you do if you're experiencing urinary problems? Here are some steps to take. 1. Write down when you pee for a few days. Note how often you urinate, any difficulties you experience, and how much you drink. 2. Pay attention to other symptoms, especially pain in the lower back, hips, or pelvis. 3. Don't be embarrassed to discuss these issues with your doctor. They're used to talking about urinary problems and can help determine the cause. 1. Lost control of the bladder. Let's tackle a topic that many men find embarrassing but is crucial to discuss: loss of bladder control. While it's often associated with aging, unexpected leakage or difficulty controlling urination could actually be one of the warning signs of prostate cancer that shouldn't be ignored. Picture this scenario: you're going about your day when suddenly, without warning, you feel a small leak. Or perhaps you find yourself rushing to the bathroom more frequently, barely making it in time. These situations aren't just inconvenient, they could be your body's way of signaling a serious health issue. Why would prostate cancer cause loss of bladder control? The answer lies in how prostate cancer can affect the structures involved in urination. As the cancer grows, it can put pressure on the bladder and urethra, interfering with the normal process of urine storage and release. Here's what you need to know about loss of bladder control as a potential prostate cancer symptom. Stress incontinence, leaking urine when you cough, laugh, or exercise. Sudden pee emergencies, you feel a strong need to pee right away and can't hold it in. Overflow incontinence, dribbling of urine due to a bladder that doesn't empty completely. Frequent urination, especially at night, nocturia. Difficulty starting or stopping urination. It's important to note that loss of bladder control isn't always a direct symptom of prostate cancer itself. In fact, it's more commonly a side effect of prostate cancer treatments, particularly surgery, prostatectomy, and radiation therapy. These treatments can sometimes damage the nerves and muscles that control urination. Here's a startling fact: studies show that up to 25% of men experience some degree of urinary incontinence after treatment for prostate cancer. While this can be distressing, it's often temporary and improves over time with proper management. So, what should you do if you're experiencing loss of bladder control? Here are some steps to take. 1. Don't ignore it or feel embarrassed. This is a medical issue that deserves attention. 2. Keep a bladder diary noting when leaks occur and what you were doing at the time. 3. Note any other symptoms you're experiencing, especially changes in urination habits or sexual function. Now that we've covered the 10 warning signs of prostate cancer, let's take a moment to understand who's likely to develop prostate cancer. 1. Age. As you get older, you're more likely to get it. It's not common in young men, but after 50, your chances go up a lot. By age 80, more than half of men have some cancerous cells in their prostate. 2. Race. African American men have a higher risk of prostate cancer than men of other races. They're also more likely to develop prostate cancer at a younger age and to have more aggressive tumors. 3. Family history. If your father or brother had prostate cancer, your risk is increased. The risk is even higher if you have multiple relatives affected by prostate cancer, especially if they were diagnosed at a young age. 4. Genetics. Certain inherited gene changes, such as mutations in the BRCA1 or BRCA2 genes, more commonly associated with breast and ovarian cancer, can increase prostate cancer risk. 5. Diet. Men who eat a lot of red meat or high-fat dairy products seem to have a slightly higher chance of getting prostate cancer. These men also tend to eat fewer fruits and vegetables, which might contribute to the increased risk. 6. Obesity. While the relationship between obesity and prostate cancer is complex, some studies suggest that obesity is associated with an increased risk of aggressive prostate cancer and death from prostate cancer. 7. Chemical exposures. Some studies have suggested that firefighters and workers exposed to certain chemicals, like pesticides and herbicides, might have a higher risk of prostate cancer. We've covered a lot of ground, from the subtle warning signs of prostate cancer to understanding risk factors and the importance of screening. But what's the key takeaway from all of this? The most important thing to remember is this: prostate cancer, when caught early, is highly treatable. By being aware of the warning signs, understanding your risk factors, and discussing screening options with your healthcare provider, you're taking powerful steps to protect your health. Remember, your body is constantly communicating with you. Those subtle changes, from urinary habits to unexplained pain, could be important messages. Don't ignore them. Instead, listen to your body and seek medical advice when something doesn't feel right. Thanks for watching. If you find this video helpful, don't forget to like, share, and subscribe for more healthy tips.